purpose of this video is to demonstrate how to use the pelvic model to accomplish the pelvic exam and the bimanual exam and the pap smear. You will typically do this exam seated, not standing. I am sitting off to the side to be able to demonstrate the technique. But typically you are sitting right here in between the patient's legs. The patient needs to be right on the edge of the table, not backed up high on the table. Always warn the patient that you will begin the exam by, here's my hand, or I'm going to start the exam. Give her some sort of warning that the pelvic exam is going to start. She has her legs in stirrups. You will want to check for inguinal lymphadenopathy on both sides. And you do that with the gloved hand. You do not have to palpate all the way down here, but just palpate in the inguinal area. The whole time that you are palpating, you should be examining the skin, the vulva, the labia majora for any kind of lesions. It is not unusual for women to have skin lesions such as psoriasis, seborrhea, that can occur on other parts of the body, and it looks identical to what it would look like on other parts of the body. You're also inspecting to make sure there are no lesions such as condyloma, herpetic lesions, or cancer, or vulvar intraepithelial neoplasia. After you have finished checking the inguinal nodes and inspection, you want to see further into the introitus, so you will use one hand to separate the labia minora. The easiest way to do that is to insert these two fingers posteriorly and separate here. You can visualize the urethra, you can see the clitoris, you can see the very entrance to the vagina. You can see if there are any lesions immediately at the introitus. Occasionally, an examiner will insert their fingers here to do the exam, but I think your fingers actually get in the way here more, and you're better to insert the fingers posteriorly. This is also a good way to gauge the patient's comfort with the exam. If she's very tight, you may be able to feel that, and you can warn her or advise her to relax this muscle so that you can complete the rest of the exam. You have inspected, you have palpated, you have seen the urethra, you see the introitus. Now you are ready to proceed with the speculum exam. Some specula are plastic. We will demonstrate with the metal speculum. This speculum is a shorter size speculum than most adult women would need. It is used, the smaller one is used because of the size of this model. The typical adult size speculum is a little bit longer than this speculum. I will be demonstrating this as a right-handed person, but most right-handed examiners will hold the speculum in their right hand to insert. You can hold the speculum with either hand. I prefer to insert with the speculum in my left hand because I'm using my dominant right hand to separate the labia again. As you pick up your speculum, you will apply lubricant or water to make the insertion easier. It is okay to apply a small amount of lubricant. In using this model, you do not need to add additional lubricant to the speculum. As you have been away from the patient to get the speculum, you would warn her that you're going to start the exam again. And you can say, here's my hand, or I'm going to insert the speculum now, but give her some sort of warning. So I'm separating the labia again. I can clearly see the introitus and the vaginal opening. You are to insert the speculum at a 45-degree angle and downward, not straight in, not extreme posterior direction, but a little bit posteriorly. So you insert at this angle. Once you are past the hymen, you can move these fingers, rotate the speculum. It is necessary that you insert the speculum fully. Do not stop here and then try to open the speculum. You need to insert to where the hilt is right here behind your finger. Once you have inserted the speculum, generally if you are right-handed, your dominant hand is on the speculum here. As there is a curve in the speculum down here, you put 2 or 3 fingers here. They will not slide off the speculum, so you can control this with one hand. As you are holding the speculum here, you will press on this flange to open the speculum and the cervix will come into view. To complete the pap smear, you will need to latch this screw down tightly so you have a hand free. It is not unusual to keep one hand on the hilt of the speculum as you use the dominant hand to get your equipment for the pap smear. For the pap smear, you will typically use these 2 instruments in the patient who has a cervix. You can start with either one of these. The intention is that with this broom, you will insert the tip into the os and press in a little bit and twirl 3 to 5 full turns at the os. You then take this specimen, put it into the specimen jar. You then take the endocervical brush and you insert the bristles all the way into the cervix and make 1 full turn with this brush, remove it, and put the specimen into the same jar that you used for the other broom. You are now done with performing the pap smear. You examine the vaginal vault, looking for abnormal discharge, bleeding, lesions, any cause of any symptoms that the patient might have had. When it is time to remove the speculum, you need to be sure and unlatch this screw. You can, again, use your dominant hand, and as you remove the speculum, be sure that you rotate it to that 45-degree angle again, and make sure that your finger is off of this flange so that you have let the blades of the speculum collapse. You remove the speculum and you put this in the appropriate container, not onto a countertop or into a sink. To complete the bimanual exam, you will generally stand, and you have 2 options: to either stand in between the patient's legs or walk around to her side so that you can use your dominant hand as your vaginal hand. You do not need to be pressing on the abdomen until you have inserted your vaginal fingers. Ideally, you are intending to insert 2 fingers. You will typically go in at this angle and rotate, much as you rotated the speculum. Your aim is to get underneath the cervix in the posterior fornix so as to stabilize the uterus. If the patient is uncomfortable or you have large fingers, it may be easiest to insert 1 finger and then insert the 2nd finger, and again reach for underneath the cervix. Only when you are in that position do you go ahead and start palpating the patient's abdomen. Your vaginal hand is not moving. You start palpating in the midline, well below the umbilicus, to feel that firmness that is the uterus. You then slide your vaginal fingers to either side, right or left, and sweep with your abdominal hand fingers to try to palpate the adnexa for masses or tenderness. You repeat the same procedure on the other side. After you have palpated the uterus and the adnexa, then you remove these fingers and you will be taking these gloves off and putting them in the appropriate receptacle. You want to start helping the patient get back to the supine position. Typically, you will pull the foot of the bed out, return her feet to that part of the bed and let her push backwards, and then assist her in sitting up.